Hi, you guys. Welcome back for our daily practice questions. It is day 53. And as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. All right, we're continuing with our anemia portion of our daily questions. Question 1 states a 40-year-old female presents with a diagnosis of iron deficiency anemia. Her hemoglobin is 9.4, MCV is 72, ferritin is low, and her total iron binding capacity is elevated. She reports heavy menstrual periods and a poor diet. She has been prescribed oral iron supplementation. What is the most appropriate recommendation to optimize the absorption of her iron supplements? Is it A, take the iron supplement with a glass of milk? B, take the iron supplement with food to minimize GI discomfort? Is it C, take the iron supplement with vitamin C or orange juice? Or D, take the iron supplement at bedtime to prevent side effects? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So the stem of the question here states, what is the most appropriate recommendation to optimize the absorption of her iron supplementation? See how this stem tells you exactly what is needed to answer this question, right? So this patient has iron deficiency anemia, currently being treated with iron supplements. So what would you, as the nurse practitioner, tell your patient to do to help optimize the absorption of the iron that the patient is on? And this is just, tidbits to know. But the best answer is C. You want to take it with vitamin C or orange juice because it has vitamin C in it, because it aids in the absorption of iron. You also more so want them to take it on an empty stomach because it allows the absorption. It allows it to absorb better. But of course, if they do have a lot of GI discomfort from it, they can have it with food. But the key is, hey, empty stomach and vitamin C, okay? Question number 2. A 60-year-old female presents with vitamin B12 deficiency anemia. Her lab results show low vitamin B12 levels. She is experiencing fatigue, weakness, and neural symptoms like numbness in her hands and feet. What is the most appropriate treatment for this patient? Is it A, oral vitamin B12 supplements? B, IM vitamin B12 injections? Is it C, folic acid supplements? Or is it D, iron supplements? Take a moment and tell me what you got, y'all. All right, so stem of the question, what is the most appropriate treatment for this patient? All right, you know what I always tell you, if they're asking for a treatment, run it back and see if they provided you with the diagnosis. In the event that they have not, then you need to run it back a step further and look at the assessment findings so that you can determine a diagnosis, because you got to know what it is to be able to treat it, right? But here they told us this patient, she has vitamin B12 and deficiency anemia, right? And she has neural deficits, numbness in her hands and feet. She has weakness, fatigue, all of the things, right? So how do we treat patients with vitamin B12 deficiency anemia? In this scenario, B, IM vitamin B12 injections are the best route. We go with IM for um, a quicker response, so to speak, especially with someone who has neural symptoms. Now, in the case where we have gotten things normalized and we're just continuing management, then you can move over to oral vitamin B12 supplements. But right here, when we're trying to get them back balanced and out of this deficiency, we go with the IM B12 injections, okay? All right, lastly, question number 3. A 50-year-old male with a history of chronic alcohol use disorder presents with fatigue and weakness. Lab results show low folate levels, a hemoglobin of 9.8, and macrocytic anemia where that MCV is 110. Remembering the normal MCV levels are anywhere from 80 to 100. So exceeding 100 with a level of 110 makes it macrocytic, right? So what is the most appropriate treatment for this patient's folate deficiency anemia? Is it A, iron supplements? Is it B, vitamin B12 injections? Is it C, folic acid supplements? Or is it D, erythropoietin therapy? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here. What is the most appropriate treatment for this patient's folate deficiency anemia? This stem of the question tells you everything you need to know. It doesn't matter all of the other things in the scenario. What is the most appropriate treatment for patients with folate deficiency anemia? It's C, folic acid supplements, right? This is why it's so important to read the stem, because oftentimes we'll sit here and we'll go down this path and we're reading the scenario and it can be fluffy and it's telling us all these details that, although are significant, is not significant to the question that is being asked. And a scenario I've been giving recently with some of my one-on-one sessions we had this week is that, hey, think about it like this. If a patient came to you and said, hey, I'm just trying to see if I need to continue taking my blood pressure medicine. And then they go on to tell you, because, when I get up in the morning, I'm eating a bowl of cereal, eggs, yogurt, fruit. Then I go work out. Then my blood sugar has been doing well. It's probably like in the 90s. My blood pressure is 70 over 50. I've been taking the blood pressure medicine, but then I was eating some salty food and I had some barbecue for dinner the other night. And then I hit my toe when I was outside doing something in the yard. Um, but do you think I should take my blood pressure medicine? You're going down this path and you're thinking, okay, they're eating like this, they're doing all these things. Wait, your blood sugar is this. You stubbed your toe. What's going on with your toe? How does it look? Is it damaged? None of that stuff matters, right? Even though it's significant, it does not matter to answer the question of should they continue taking their blood pressure medicine. The only thing that's mattered was the fact that they said, hey, my blood pressure was 70 over 50, which gave you the answer to say, let's hold this blood pressure medicine for now and recheck. You know what I'm saying? So think of it in that scenario. If the patient came in and said, um, what should I do for my folate deficiency anemia? You're going to know to say folic acid supplements, right? So that stem of the question is like what the patient has come in to ask you. What should you do with this? And then go back and look at the scenario and read through so that you know what to pull from it and you know what to eliminate. Because I don't care how y'all say it. You can say you read the full scenario and you can tell me that, you know what, I know I'll process through or what have you. But when you're preparing for NP boards, that means you have a nursing background already. So as we read through these scenarios, we naturally begin to assess, we naturally begin to process it, we naturally begin to think of what needs to be done next. And some of that stuff is just extra for the scenario, extra for the storyline, but it is not needed for the answer. Read that stem of the question first and watch how much it helps you to eliminate all of the outliers. And tell me how you do. But all right, y'all. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, you know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.